Did you know that your menstrual cycle gives you insight to what's going on in your body? Your period actually gives you clues about your overall health and, in particular, your fertility health. So, we are going to unpack today what a normal menstrual cycle looks like. So, be sure to watch all the way through. So, I'm going to share some really important information for you on what a normal one is. And while you're listening to what a normal cycle is, I want you to reflect on your cycle, so either you can start paying attention to it and learn from your body, because your body will tell you exactly what you need to know, or you can learn about it and figure out that's not normal. Now I know that there's something off with my menstrual cycle and there's something I can do about it. So let's go ahead and start unpacking and start right now. I'm Denise Noyer-Erez, and I'm known as the Fertility Godmother, and I help women all over the world prepare their bodies for pregnancy. And so let's go ahead and let's do this now. All right, so first of all, what is a normal menstrual cycle? Well, technically, the normal menstrual cycle is 28 to 30 days long in length. So it starts day one, starts when you actually start to flow. Your period actually starts flowing. It's not about the spotting. You don't count the days of spotting beforehand if you're spotting. And that's a clue that there might be something off if you have a lot of spotting before your period. Now, a little bit of spotting, like a couple hours before, is normal. It kind of gives you a clue that things are coming, that your period is coming, but you don't want the spotting beforehand. So normal cycle is your period just starts. You don't really know it's coming. You might have some sensations in the abdomen. You might have a little sensations in the breast. You might have maybe a little bit more tired, but not like so exhausted where you can't get off the couch or your bed. You don't want to get out of bed, or if you have pain, that's not normal. So normal is it comes. Day one counts with your flow starts. Now that's just one more thing that's important. Just staying with day one is day one you count, and if your period starts in the morning, you're going to count that day as day one. If your period starts after 6 p.m., you're going to count the next day as day one, which is a little interesting note, because that always gets confusing, right? What time do my periods start? When do I count day one? I know it's really confusing. So that tends to be the rule of thumb. So I hope that's helpful for you when you're starting to count your days. So now you should bleed for 4 days. Not less than 4 days, not more than 4 days, but 4 days is the perfect amount. So you can, have some wiggle room, of course, but I'm talking about a normal healthy cycle. And the reason you want 4 days of bleeding is because your body is shedding this old uterine lining, and it needs to replenish and rebuild the fresh uterine lining. So you need to get all that old tissue removed so that the new tissue can be regenerated and you don't have any, you have a nice fresh uterine lining, because that's going to be really important, because that's where your baby's going to implant and snuggle in, right? So you want to make sure that that's a really healthy, clean environment. You also need to make sure that you're having enough blood. So if you're not if you're not bleeding enough, then you may be losing blood, right? You may not be losing. You obviously are losing blood during your period, but you may not have enough blood so that you can build a nice fresh uterine lining. So that's another thing that's really important. So and then the color of the blood is also going to give you clues. So the color should be bright red, and it should have a nice flow. The consistency needs to be blood-like, which is a little bit thicker than water, maybe like a milk, right? It's a little bit thicker, but it shouldn't be sticky, right? That's something that you don't want. So normal is just, again, cycle day one, you start the flow. It's like, oh, she's here, and you just go through it. Nice fresh blood, not a lot of pain. You bleed for 4 days, and you stop, not the spotting afterwards. And that's what a normal period looks like. Now, your body is doing all these amazing things. I mean, you have no idea, unless you study this, how much your body goes through to have a period, to regenerate the uterine lining, and then produce follicles so that you can ovulate. And it kind of does this all synergistically all at the same time. Your body is amazing. And so what happens is now your body starts to grow a follicle, and inside the follicle is your eggs. Well, it's one egg in each follicle. And what happens is your body actually grows multiple follicles until it gets to a certain point where your body says, okay, I just want one dominant follicle, one dominant egg at a time. And so it picks the strongest one where all the energy can focus on that follicle, so that when your body releases it, it's a nice, nourished, strong egg. And then it gets released out and into the fallopian tube, comes down. Hopefully the sperm's there already, and it meets the egg in the fallopian tube, where it fertilizes and grows until it starts to developing into an embryo and travels down, where it can meet in that nice cushy uterus that you have, because everything is fresh and healthy and you have enough nourishment in your uterine lining. It's like we like to say in Chinese medicine, you have to nourish the soil, right? So you have to nourish that soil so that it can implant the healthy seed. So around ovulation, you really want to pay attention to your fertile mucus, right? So you're going to have different discharges throughout your menstrual cycle. So around ovulation, it changes to that. They call it the spin barky. You may know about it. If not, I know a lot of women that don't know about it. But you want to test and make sure it should be like a little sticky. Now, this is really important because if you have a good fertile mucus, this allows your body to nourish the sperm. So the sperm can live inside the vagina for 2 to 5 days. So if you can have a good environment and you have good fertile mucus, you're gonna be able to nourish the sperm. It can survive longer. The other thing that's really important is that sperm uses the fertile mucus so that it can track right up through the vagina and get into the fallopian tube so it can meet your egg. So that having really good fertile mucus at the point of ovulation is really key. So that's what's normal, is having it at that time. Little side tip here, if you use lubrication, make sure it's safe for the sperm and for the vaginal environment. There's a lot of things that are toxic out there, so it's important. Okay, so that's something that's really important. So one thing that you can do is a basal body temperature chart. Did I say that right? One thing I want you to do is track your basal body temperature. So I actually made a checklist for you, so that's really easy for you to make sure that you're doing your basal body temperature correctly. And we attached a chart to it, so you'll have the instructions in there. So click on the link in the description below, and you can have that. And if you're watching this on Instagram, then you'll go to my bio. It'll be in my free resources, in the Fertility Godmother's free resources, and go ahead and get that checklist to make sure that you are doing it right, and you can understand the things that affect a basal body temperature. But that's really going to be helpful for you to pay attention to your body, because your body, again, it's going to tell you everything you need to know. Okay, so now let's talk about the luteal phase, which happens after ovulation. And the luteal phase should be around 14 days, 12 to 14 days. 14 days is optimal. So there's something called a luteal phase defect, which is usually when your luteal phase is shorter, like maybe it's 7 days or 10 days. Then if that's the case, we need to lengthen it. But we're going to dive into this and another T, so you'll have to come back and check out the next T. But a normal cycle should be 12 to 14 days. And if you're taking your basal body temperature, your temperature will actually go up that second half, and it should stay up. So that's going to be another important thing for you to do, or to notice, not to do, but to notice about your body. And if you're taking your temperature, which you can get that checklist in the description below or in my resources in the link above, then you can make sure you're taking your basal body temperature so that you can watch that, and you can watch how things change and see if anything happens. And then if you're pregnant, God willing, which will happen for you, you will want to keep that luteal phase will stay even, or it can even go up higher. If it drops, then that's your hormones, which is the progesterone stage. It's going to be dropping at that time, and then your body will should start your next menstrual cycle, and then it just repeats and does it again. So that's what technically a normal menstrual cycle should look like. It should be flowing and free and just going smoothly. And if you do your basal body temperature, it'll give you some clues, because you'll see if the lines are consistent, if the lines are all over the place, or you know, and also pay attention to your signs and symptoms before your period, your moods, and your cervical fluid. So pay attention to your body, because it's going to tell you exactly what you need to know. All right, we will see you here next week with Tea with the Fertility Godmother, and I look forward to seeing you then. Take care of yourself, and make sure to subscribe and click that bell if you haven't already. See you next time. Bye-bye.